Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Suicide Treatment, Part 1. Once the crisis is over, possibly treated with psychotropic drugs, we start the treatment. Once, in consultation with the patient, we will approach the subject of suicide directly, slowly and empathically. We will never trivialize any suicide attempt. The first thing we must find out is what has led the patient to think about suicide, and also what type of disorder the patient suffers from. If the patient has a depressive disorder, we should treat this disorder and reinforce the treatment with secondary exercises. We will design a treatment depending on the disorder the patient suffers from. This treatment should be reinforced with aversive exercises, where the patient sees what happens to him or her in a suicide attempt, where he or she has not succeeded in taking his or her own life, and on top of that, has been left with irreversible consequences. For example, they can see in an aversive exercise how they have thrown themselves out of the window of their house to kill themselves. Not only has he not managed to kill himself, but on top of that, he is now much worse than before. Let's see an example of an aversive exercise for suicide. Aversive suicide. I want you to visualize yourself in one of your suicide attempts. You throw yourself out of your bedroom window. As you throw yourself out, you realize that your little sister has seen you. She is horrified as she watches you fall towards the street. You hear her screams. It is such a deep scream that she ends up screaming without saying a word. She ends up screaming without uttering a word, without vocalizing anything, without noise. She ends with a mute scream. You see all this as you fall. Now you feel a violent and loud blow on your head. You stop feeling, you stop seeing, you stop hearing, you stop listening. You open your eyes and see yourself in a hospital room. You are full of wires, of rubber bands, of drips, and surrounded by machines that emit strange sounds and noises. However you are, without any pain, without any discomfort, you decide to get up. You try to get up. Curiously, your body remains still. You are confused. You want to move, and your body remains still. After hours of unsuccessful attempts to get up, you end up tired and you remain still, without understanding what is happening. Finally, the medical staff comes. They greet you and tell you that you have become paraplegic. You can only move your head. They have to feed you. They have to clean you every time you relieve yourself. You are catheterized and need life support. You are on life support. All this for the foolishness of trying to run away from your problems by committing suicide. Now you are worse, much worse than before, because your problems are still there, and now you have added more problems. Among them is the problem of your immobility. You can only move your head. You want to say how sorry you are about this whole situation. However, it is impossible for you to speak, as you are on life support, and this prevents you from speaking. You feel upset and sorry. However, it is impossible for you to say it, as it is totally impossible for you to speak. Now you are much worse than before. There's even more. Now you're told that your younger sister, yes, the one who saw you throw yourself out of the window, has become mute. She has stopped speaking since she saw you throw yourself out of the window. Because of you, she has become mute. She has a strong trauma that will possibly mark her for life. All for wanting to kill yourself. All for thinking only of you. All for being so selfish. Now you are bedridden for life, unable to speak, unable to do anything. You can't even try, because now you can only move your head and you depend on others to live. If you only want this to be a dream, you must think only about living, about fighting for your life, about thinking about others. There are people who love you. A lot of people love you. More people than you think. There are many solutions. There are others' way out. If you need help, ask for it. Now you feel that you want to live. You feel that you want to do many things. Now you feel like living. Now you have many illusions to live, to enjoy life. Now you are going to live with hope, with illusions, and with many projects to do. Now you feel good, you feel happy, and with a lot of desire to live. This treatment is composed of primary exercises, where we'll put a cognitive exercise, a behavioral exercise, an aversive exercise, a self-esteem exercise, a self-concept exercise, a self-control exercise, and a combination of crisis exercises. For example, the room combined with salivation will end with a post-hypnotic command combined with the whispering technique, followed by the ending, the key, and the exit from the hypnotic state. All of this should be reinforced with secondary exercises such as a drop of happiness, all positive, goals, etc. We must treat both the disorder you're suffering from and your suicidal intent. Normally, when treating the disorder he's suffering from, suicidal intentions fall by domino effect. But as this is a very serious issue and there is a consequent danger of death, we cannot risk waiting for the domino effect, and we treat both directly. The disorder that has led to the suicide attempt and the suicide attempt itself, taking into account the patient's social and environmental stressors and any problems that could aggravate the patient's psychological balance. It is always important to work on self-esteem in any disorder, as it is the glass leg within psychopathologies, and it is the first thing that fails in all patients, especially in the suicidal population. Cognitive psychology has found that it is hopelessness that is linked to suicide. Therefore, its treatment is aimed at correcting these negative thoughts and instilling hope. From this point of view, we can design a treatment with a combination of primary and secondary exercises that correct or eliminate these negative thoughts and increase hope in the patient. In addition, we can instill confidence in the success of the therapeutic process and try to reinforce the patient's ability to find options and alternatives to suicide. We must also use physical contact, especially the hugging technique, to make the patient feel loved. We should talk to them about pleasant things, both past and future, We must listen to his despair and worries, make him feel useful, valuable, etc. We must change the concepts of killing oneself to accepting and loving oneself. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Suicide Treatment Part 2. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So if you're interested, do not miss our next videos. Thank you very much.